Our eyes have over 2 million working parts and contribute about 85% of everything we know. So when our vision isn't at its best, we can turn to some fantastic technology.
Deteriorating eyesight is a fact of life for many people, whether it's genetic or lifestyle. I've been wearing glasses since I was in primary school, and today I'm here to be assessed to see if I'm eligible for Laysic eye surgery. Hopefully it's going to be all good and I'll be able to get the procedure done and hopefully never have to wear my glasses again.
Laysic surgery is highly specialized and can only be performed by qualified specialists to correct certain visual problems. Each patient is assessed to determine their eligibility.
So Dr. Lopsha, what are we looking for with the test that we do today?
Firstly, we need to measure your exact best corrected visual refraction, because that is what we're going to need to put into the machine, and that will do with ablation. We need to measure your corneal thickness or the health of your cornea. We're going to do a three-dimensional scan which picks up 25,000 points on your eye, and that will give us a 3D image of your eye.
With Laysic eye surgery, what else does it fix? I mean, I know I'm short-sighted, so I'm myopic. Can it fix an astigmatism and someone that's far-sighted?
Can correct myopia, astigmatism and hyperopia, or combinations of those. And then that will be within parameters of what the laser can do and what your eye will permit us to do. Anything higher than that would need different type of surgery.
How long does Laysic last for? Because I think people are under the impression that you won't ever have to use glasses again.
You know, if you do everything according to the indications, then it would last the patient 15, 20 years at least.
What type of patients are eligible for Laysic eye surgery?
Healthy patient with a healthy eye, a stable refraction, meaning your prescription has not changed dramatically in 2 to 3 years, and in the age category that would benefit from the laser surgery.
During the mid-80s, laser vision correction was introduced. The principle on which it worked was quite revolutionary. Instead of treating the symptoms of poor vision, the laser aimed to permanently correct an incorrectly curved cornea to restore vision.
Dr. Lopsha, what are the complications that come with Laysic surgery?
Laysic is actually very safe surgery. There are obviously a few complications that can occur. Most of them do occur when you are actually cutting the flap. So it is a mechanical device, so you can have bad flaps or interface problems or even weakening of the cornea. That's why those instruments are always checked before surgery. The laser is calibrated, and all these complications are less than 0.5% of surgery cases.
So after all these tests, what are the conditions of my eye, and can you run me through what the procedure will be like in theatre today?
Yes, Deveja, you are a healthy young person with an active lifestyle, and you have a healthy, stable cornea with a refraction that falls in the boundaries of what the laser is capable of doing. So what we are going to do is we're going to anesthetize your eye. You're going to be awake. We're going to make a small flap or cut in your cornea. We're going to lift that, and the laser will take a part of your central cornea away or ablate that, and we'll put that back and refocus your vision. So when you get up from the bed, the focus is already done, and you can actually walk out of the room with the vision that you had with your glasses before and now without.
And hopefully I'll never have to wear glasses again, except for reading.
Well, that's the idea.
Surprisingly, laser visual correction surgery isn't painful. The eye is anesthetized and no needles are used. Within 24 hours of the surgery, your eyesight will improve and patients can resume their usual daily activities in 2 days after surgery. There's further rapid recovery within the first week, but it takes around 3 months for your new visual acuity to stabilize. It's important to note that most medical aids don't cover the cost of laser eye surgery. Please check with your scheme if they do or don't cover the cost of treatment. As for Deveja, surgery is just about done, and she's overjoyed with her experience and even her new temporary eyewear.
So less than 20 minutes later, surgery is done. I thought I'd feel a lot more sensitive, but I'm actually not. I do know I look a little bit like Fly Woman, which I think will be my superhero status from now on. But if this is what Laysic surgery is, then go for it. Nice and short procedure, and within 6 hours I'll be able to take off my eye covers and see perfectly.